of the morning, and for that I call upon Dr. Sampada and Dr. Manish Patel, who were the chairpersons for the session. Please, sir, I invite both of you on the dais. Please, first summarize, because
the session is being started from the time, which we left over. That means Dr. Manish Patel and Dr. Sampada, they have to give their reviews on the earlier speakers, and then they will be facilitating them.
Good morning, everyone. With kind permission of our co-chair, Dr. Sampada Joshi, I would summarize about our first session. Friends, we listen first Dr. Prakash Shinde. Really, after listening him, I remember our masters, Dr. Hahnemann, as after completion of his MBBS, he was not satisfied with that practice. And he started homeopathic practice. He treated many hopeless and critical patients in their clinic, especially cancerous, who patient is suffering from the cancer. Friends, he realized, he knew, in our science, we don't have we don't have medicine for the cancer, treatment for the cancer, except some symptomatic treatment. Even he knew that the treatment, which is mainly chemotherapy, itself is responsible to create some cancerous condition. And on the contrary, he realized it is not a proper treatment, and finally he came to know that we need to cure the patient as a whole. And that is only you can cure, you can find in homeopathic science only. Yes, he also said the prescription, homeopathic prescription or prescription of the homeopathic medicine, it is a one type of art. Here I would like to share a small article of the Stuart Close, our doctor from his philosophy. Stuart Close says, homeopathy is both an art and science. The successful homeopathician must be both an artist and a scientist. His work must be both artistic and scientist, because art and science are inseparably bound together, and every art has its own foundation in the science, and every science finds its expression in his arts. So friends, really Dr. Prakash Shinde, really you and your practice is commendable. Keep up the good work, sir, and on behalf of IHF, best wishes for more future successes. Thank you very much. Friends, in our session, our second speaker was Dr. Muhammad Rafiq from Kerala. He gave us the good clinical tips, and his concept was when in some emergency or in some one-sided disease, you cannot have, or sometimes you cannot have some more symptoms, or in emergency, you can think of some specific medicine, or you can use the tips which have been given by our stalwarts. Simply, we must see what, according to, Simply, we have to treat according to our patient's situation, means your patient is your authority, and your patient will tell you what to do. I read one article in article from Robin Murphy book. Robin Murphy book. He says in some difficult or patient came with many complaints, first you must treat what is the more threatening to the patient, and then you will get the new symptomatology, and you will get, accordingly you will get the second medicine, and ultimately you will treat with some one constitutional medicine. So that is the cure, right? Simply, in short, so whenever in emergency or whenever you do not find some particular constitutional medicine, you can use some specific medicine or you can use some clinical tips. So congratulations, Dr. Muhammad Rafiq, and on behalf of IHF, best wishes for the future successes. Thank you very much, sir.
I now invite Dr. Shinde on the dais to receive an award of appreciation. Please, ma'am, backdrop is idhar aa jaiye. Let's all give a big round of applause for Sir. He's doing a wonderful job. A disease which is still needs a lot of research, a lot of dedication. He's doing a very good work with homeopathy in that field. And we wish him all the best, that he does a lot more good work on that. And I now invite Dr. Muhammad Rafiq from Kerala to please take his award of appreciation. His lecture was indeed very fruitful, and I'm sure the bags are full with tips and lot many other things. I now take you all, the august audience, to our next session, the sixth session of the entire IHC and the second session since morning. I call upon chairpersons Dr. Leonie and Dr. Indrajit Nanda. Please. We have 3 speakers for this session. Dr. Vishpala, who's going to speak on systemic lupus erythematosus under the theme Bullseye Diagnosis. Then we have Dr. Ravi Veragade from Nagpur, who would be talking on liver cirrhosis under the theme Lifestyle Disorder. And third speaker would be Dr. Praveen Jain from Mumbai, who would be taking essential observations in pediatric case taking under the theme Infants to Adolescents. I now give away the mic to our chairpersons, who would be telling a bit about our speakers and starting off with the sessions.
Now invite Dr. Vishpala. I think everybody knows her. She is a popular speaker and wonderful homeopath from Mumbai. She is editor-in-chief NJH, and she is now presenting her topic, Living Under a Cloud. Dr. Vishpala.
Good morning, everybody. I want to thank the organizers of International Homeopathic Congress for inviting me to talk at this first ever held Congress under this banner. And I must say that it's been very nice 2 days we've had. The arrangements are excellent, and the food was superb, and the talks were very good so far. Now we have to see how it is further. Hello. Session, Living Under a Cloud, is the name of the session. The patient said, I feel so low. But when the cloud lifted, patient was all smiles. So we are going to take you through this case, and we'll show you how the case gets resolved. But before that, I want to talk a little bit about education. Yesterday, you all remember that Dr. Farooq Master talked about continuing education all the time. So our homeopathy is a wonderful science. But you all know that the selection of the remedy is still largely subjective. You agree with me? It is mainly what I know, what I feel, and I think this is the best indicated remedy is what we say, because we deal with symptoms which are subjective. So it is the patient's pain, it is the patient's ulcer, it is only rarely that we can see an objective symptom. Currently, of course, we use a lot of investigations, and many a times the clinical diagnosis the patient already comes with, that he has cancer of the throat or he has systemic lupus, as we are going to talk today. He already comes with the diagnosis. But it is rarely that we use that for our remedy selection. So it is not wrong to say that largely it depends on the prescriber's knowledge at that point of time. Add to that, homeopathy does not have an established hierarchy of referrals. Means if I have a difficult case, there is no hierarchy. I can go to the next person or even a senior person, because in homeopathy, everybody is a consultant. Everybody is an expert in acute, chronic, cancer. Everybody treats everything. You know, in the other systems, they have a hierarchy which we don't have, which we should establish. What is lacking is also introspection of our own work. Every 1 or 2 years, we should look at our cases and see where we have reached, where are our difficulties. So we are increasing our knowledge all the time because we are talking, we are writing, we are reading, we are listening. But are we really improving? Today's presentation I am giving basically as a live example of how I have matured over the last 40 years. I'm practicing for 40 years. 20 years ago also I was a good homeopath. 10 years ago I was a very good homeopath, but that's what my patients said. What did I feel? Did I feel that? Today I can say, yes, I am a good homeopath because of continuous learning. CME we know is the new buzzword. Doctors continuously need to be updated. I've been doing it right through, beginning after college with solid training at the ICR under Dr. M.L. Dhavle. Later, of course, we set up the MLDT hospital, the institute, which is an icon for homeopathy today with a 100-bed hospital. And if you look at the new auditorium, it is like state of the art. Then I started the National Journal in 1992. We have 196 issues, and all of them I've edited. So I'm reading and educating myself continuously. These are some of the issues. We hold annual memorial, Sarla Sonala memorial seminars every year. This was our 2016 seminar, and we've already announced our 2017 seminars and the Maharati speakers. So what have I been doing? I've been speaking at seminars, writing articles, writing cases, teaching. I was doing it all and getting all-round experience and growing, I thought. Practice was good, results were good, but of late, with 37 years experience under my belt, very difficult cases started coming. And then I found that I needed to expand my horizon. It was not enough. All this I was doing, and still today I can say it was not enough. So when the sensation method became the synergy method, rooted in fact, it became more like repertory, what we know, the genius, then I thought this was more suited to my temperament. In 2013, at the ripe old age, I joined the master's course at the other song, which is Dr. Shankaran's Academy. In 2014, they got the FCH course permission, so the masters flowed into FCH. It took me a good 2 years for me at my age, plus when you're steeped in one school, it is more difficult to learn another school when it is a little different. This is the Other Song Institute. So today, I can say that I have 2 schools experience and learning under my belt, and I feel I'm a much better homeopath because of that. Yesterday also, Dr. Farooq Masters talked about the Calcutta school and the Dhavale school. Today, I'm telling you about the Dhavale school and the Shankaran school. It is never enough. That is my message to all of you today, that it is never enough. I'm an expert, I know this, I treat so many cases. We don't know how well we are treating, and nobody can know. We ourselves only can know. That is what I want to send you off with today. So what have I done today? I've selected an older case, means a case which came to me before this study, and I introspected later and how the results have come. So we have to see the quality of the result. Let's talk about the case. Today, everybody is under risk of depression due to the stress of living. We are talking about living under a cloud. Not only is the stress of living, but also of work, of the disease, and to keep it hidden. If some people come and tell us, I'll give you an example. He had a patient in Palghar Hospital. Now, Palghar Hospital, as you know, is a charitable rural hospital. A patient came with just a lipoma, but he had lipoma all over on the scalp and everywhere. And he's saying that I want to go abroad, but if they see it, they won't let me go. So all the time we are under stress, not only of the disease, but of keeping it hidden. And then if you know that there's no cure, it makes that even worse. This is what we will see in this case. This patient of 38 said exactly that to me. She said in 2012 and again in 2015 that I feel hopeless, depressed, and sad. I feel like doing nothing, just staying at home. She's given up her job. She's an MD pathologist, and she gave up her job and sat at home. The disease began when she was in second MBBS, and it has continued all her life. So she really feels that there's no escape. She tackled it, took medicines, whatever, and carried on. She did her MD, she did her job, she did marriage, she had a child, but she all the time felt guilt of not keeping that open secret that she has this disease. The diagnosis was systemic lupus erythromatous. It was like a noose, around her neck. She had, of course, whatever other complaints she had, very painful blisters, gums bleeding, burning from spicy, cold, all that, and Visalon, which is like a blanket, no longer helped. A blanket which helps you to keep the disease under wraps. She had the butterfly pigmentation, erythromatous, macular rash on the cheeks, on the upper lip, chin. Usual, there were modalities, aggravated sun. Painful hard rash, which is paniculitis, on the calves, thighs, and arms. The biopsy showed calcium deposits. She also had hemorrhoids with fissures, constipation with very hard stools, which are now better, But the hemorrhoids had very severe backache and pain in the calves. We would think this is very characteristic and help us to find a remedy. But really it did not in the repertory show, and I took better by warmth and better by pressure, as you'll see later on. She had cold, sinusitis, very bad, attacks every 3 months for whole month. What can we tell from all this? That her immunity was very low. If she was taking so many steroids and all, immunity is going to be low and all her diseases were going to come up. But the last straw, she had so many things, but the last straw on the camel's back, what does that mean? The thing which really troubled her most was her hair fall, because she was not able to hide that. All these other things she hid. So she had this bald patch, very big, on the occiput and on the side parietal region. If you look at her past history, she had TB. Again, when you have a lot of immunosuppressant drugs, you are bound to get these diseases. Family history, sister had psoriasis, vasculitis, a cousin had multiple miscarriages, so there was a syphilitic family history. In the patient as a person, the only things which were characteristic were profuse clammy perspiration, craving for sweets and ice cream, and aversion to spices. Walnuts aggravate. Sleep was refreshing, but once a month she would get weeping with starting and lots of thoughts. Dreams were also once a week. A girl who's MD, done very well, but her dreams are always in India. I don't know. People abroad, do they get dreams so much of exams? Everybody has dreams of exam, not finishing the paper, failing. Yes, can somebody answer me? Every patient almost has this dream in India. People from abroad, I think our exams are very stressful. Okay, so what was her life story? She was the second daughter. Now in India, again, sons are preferred. We would always, once you know it's a second daughter, you would say, keep in mind if there is any problem going to be there. But it was a very educated and progressive family. Grandfather was in the army, so she said she didn't have any such thing, and she was a very loved child. But because she had so many illnesses, her childhood was difficult. As you know, Sally was diagnosed very early. She finished her MBBS, she finished her MD, and she was in relationship with a boy from the Jain community, but she did not inform her family. Later, she got married. That was, of course, with consent of everybody. Her husband knew of her disease, and so did her father-in-law, but no one else in that family knew. Her mother-in-law till today does not know. So the stress of finding out is always there for her. 2005, she had a relapse, fever, stress, and the guilt. Husband has been throughout very supportive. 2012, she got cough, which was interstitial lung disease, but today she has nothing of it. It has gone except for that phlegm which comes. Today, she still has the ulcers, the non-healing punched out margins, and yellow pus. In January, she took the wonder drug allopathy, rituximab, and she was very much better. She was very happy. But with the 4th dose, she had a severe anaphylactic shock, fever with chills, so she was very, very low because she knew now she could never take that drug again. This was the only drug which she felt she was helping. And then April, she developed that bald patch and she stopped going to work. Very embarrassed, very depressed, very conscious of the hair loss. Feels that this illness is worse than having a kidney disease or having a jaundice or having any other illness. And because continuously people comment and talk about it, kya ho gaya? You know, in India, again, we have a very helpful society who gives you tips all the time. Ye doctor bahut acha hai, aap ye nuksa kar lo aur zarur theek ho jayega. And she says, I can't bear it. I can't show it, but I really want to say, why don't you mind your own business? I'm a doctor myself. But she is very polite, so she never says it. So it is worse. Then she weeps and she stays at home. She came back to me in August 15. which is only about 6-7 months ago. By September, small hair started growing. By January, skin was better, hair was better. And by February, full head. We'll show you all the pictures. Marks also fading. Now she's happy. She wants to rejoin work. All the depression is gone. She wants to start yoga, dance class. Means she is back to a nice, healthy human being. So what is the totality you will take, or which I took even earlier in 2012? Excitement, anticipation events, weeping ameliorates, brooding, consolation ameliorates, company likes of known people, and guilty. Anxiety, palpitation with trembling hands, craving for sweets, clammy perspiration, better warmth and pain. So these were the remedies I got. And now what? You will say there is so much anxiety, so much panic, backache, and the sweating. This looks like Kali Ka. How many people will say that? Some. So I said it is syphilitic. Let's give Kali Rs, especially for the skin and depression and syphilitic miasm. There was a very good amelioration, but just for a short time. Then that's it. It didn't go further. I tried higher potency, so many things. It didn't work. So where did I go wrong? Anyone? Any suggestions? Hello? I've given you the whole case. What did I do? I stood on one leg. I did one repertory, one leg. How much can we stand on one leg? Today I'll try. I need support even for 2 minutes, right? So you need at least 3 legs. Who told us that? Kent. So otherwise you will stumble and go wrong. So you need Kent's 3-legged stool. So you have to review the case from all angles. One angle, one thinking, my feeling that this is Kali, so much anxiety, backache with even constipation, all that is not enough. So we have to think of the other 2 angles. So which are the angles? You have to have the genius, the system, symptoms, and the system. If you talk about the system, which kingdom, which family, which miasms, not only the repertory. Yes? So this patient, what did we know about her? This is the worst disease ever. Worse than a kidney or a renal disease, like death. She says, I feel so embarrassed to be asked these questions and advised. I want to tell them to keep quiet, but I can't. So you see the marked sensitivity to the situation? Yes? So, which is the kingdom? Plant. So then how will a mineral kingdom work? She's not talking structure. She's not talking rationally. She's saying, this is what I'm sensitive to and this is how I react. So sensitivity and reactivity is not the mineral kingdom. So if I choose Kali Rs, it's not going to work. Yes? No? Yes? Yes. So it is the plant kingdom. Now, which family in this plant kingdom? Anybody? Yeah? So this is like death. So much it hurts. I feel so guilty. We all know this remedy. Which is that remedy? Yeah? Come on, we know. Which is the famous remedy which we have for this? I feel like death. It hurts. Yeah. So it is Staphylococcus aureus, okay? So, but this is not Staphylococcus aureus. It is the family. It is the right family, but it is not the right remedy. So you should have a little broad understanding. So it is the exact state of the Ranunculaceae family. First, let's understand what is Ranunculaceae family. We know it, but we don't know it in so many words. This is the buttercup family. And which are the remedies which belong to this? The aconite, the simicifuga, clematis, helleborus, hydrastis, pulsatilla, ranunculosis, and Staphylococcus aureus. So most of these, I've chosen particularly this family because we know all the remedies in this. There are so many families, we don't know a single remedy. Okay? So what do I want you to take home today? To understand that we know all the remedies. So what is the common thing in this family? How did this become a family? A family means related, right? There has to be commonality in it. So what is the commonality in this? All these remedies. We know, symptoms we know are menses are affected after vexation or anger. So that means we know emotions have an effect on genitalia. We know that there's a strong psychosomatic element. The mind is affecting the body, especially the hormonal system. We know that there is a pathway between the mind and the body towards hormones, nerves, and genitals. Okay? Now we know this from just knowing symptoms of all the remedies. We know that in Staphylococcus aureus, Phatak says, he is morbidly sensitive. This is then true of the whole family. Aconite is very sensitive and reactive. Helleborus is extremely dull. We saw Manoj Patel's case yesterday. The person was not reacting. I'm not telling you the remedy of the family, I'm just telling you that reaction. The person was not reacting. You were asking questions, there was no reaction. That much dullness Helleborus has. So the reaction comes much later. So in terms of nervous reactivity, there is sensitivity and bluntness which are at opposite poles, which run through this whole family. Clear? Is anybody understanding what I'm saying? Yes? No? Yes. Thank you. So we see both in our patient, what sensation affects them the most? This is my question to you. In this family, what does affect them the most? If we see the rubrics again, it shows the mind body and sensitive after guilt and mortification. Okay? So in mind chapter, we have these rubrics, ailments from indignation, from mortification, from humiliation, from chagrin, which is anger suppressed, emotional and mental ailments from. These are our rubrics in the repertory, in the materia medica. Ailments from anger, vexation, grief, and silent grief. Anger, irascibility, tendency, trembling with, effects of the emotion on the nervous system. And in generalities, we say these are all the mind. What about the body? In body, what do we have? Stitching pains, pains which are sharp, stabbing, stitching, stinging, which corresponds to vexation on a mental level. Means that is feel that somebody is needling you. What did this patient feel? Constantly somebody is telling me what to do, as if they are needling me. You know the word needling, do you understand it? That they are constantly making me feel bad, that I have something which is incurable. They are reminding me all the time, prodding me, vexing me. Can you see this in the patient? You just need to expand this to the whole family. So what would she like? So the compensation of this family is, I want to not let it affect me. I want them to say whatever, but I want to be calm and equanimous. Means I don't want that to affect me, not needle me, not vex me. So that is the compensation or what the patient wants. So what does our patient try to do? Because she's so needled, she tries to hide. She's hiding, not facing the situation.